Shriners Children's New England has a new program for cranial remolding, a process designed to treat babies with head abnormalities. Recently, I got a closer look at the program after speaking with the team spearheading the service. Many of us have seen infants wearing helmets like these, but how many of us know about the critical role they play as a baby's growth accelerates?
There are abnormalities that come about, and most commonly that's related to progressive change in that symmetry.
Unintentional abnormalities can be the result of a variety of conditions: limited space in the womb, birth trauma, or neurodevelopmental delays. One of the most common causes:
babies typically are lying on their back, and we promote lying on their back for safe breathing. However, if a child is sleeping on their back in the same position, with the back side of the head always in the same position, it can progressively cause twisting of the head.
If left untreated, it can lead to physical complications down the line, including facial asymmetry, jaw misalignment, and visual challenges, all by the time it's too late to correct without invasive procedures.
That is oftentimes fixable through remolding or repositioning. The child's head has a soft spot, and that typically closes between 8 to 12 months of age.
That's when Dr. Jonathan Lee enters the picture. He works with families to create a specialized plan offering a seamless, efficient course of action from start to finish.
We have a lot of different specialists working together to treat our children. The first initial visit is typically with me as a craniofacial specialist, and I will be evaluating the child and determining if a repositioning helmet or remolding helmet is necessary or needed. I'll also determine if the child needs some additional support from our physical therapy team.
Dr. Lee walked us through the next steps if it's determined the baby would benefit from the helmet.
The patients and the family meet with our team of orthotists, where the patient will get scanned and measured to start helmet therapy.
Now, if you're like me and you're hearing the term orthotist for the first time, it's a specialist who creates and fits braces and splints for needed extra support for body parts. Liz Selgrade is one of the orthotists working side by side with Dr. Lee and the families.
We can design custom helmets that focus that growth on areas that we want to be more round.
Creating the helmet is done through state-of-the-art technology.
We use a handheld scanner to capture pictures of the baby's head, and then we can use those pictures to make a 3D model of the head that is then used at an FDA-approved facility to make a helmet that we fit to the baby's head here.
Getting a baby to stay still enough to fit the helmet sounds like an impossible part of the process in itself. That's what makes the care of specialists like Selgrade so exceptional.
And we have different tools that we can use for distraction. So my favorite tool is this little light-up fan that blows air and has the lights to distract the baby.
The work with Selgrade and Dr. Lee doesn't end when the helmet goes home with the baby. Families have follow-up appointments every few weeks throughout the treatment, tracking progress and making adjustments as needed.
Because the helmet relies on growth and a baby is growing all the time, we need the baby to wear the helmet 23 hours a day to capture as much growth as possible for the treatment to be successful. So typically a baby wears the helmet about 3 to 4 months of time. Really depends on the severity of the head shape and how much change that we're trying to achieve.
A long process, but the outcome is well worth the dedication.
I think after the treatment, most families are excited that they went through it. They feel proud of the commitment that they've made. It's a lot of hard work that the families have to put in, but it benefits the baby in the long run.
The results can be a life-changing difference. Dr. Lee says he knows it's a loaded situation for parents, but he tries his best to redirect focus onto the end results, not only improving the skull cosmetically, but also functionally, and in turn, the quality of experiences throughout life.
It's very important that a child's head is able to fit the protective helmets that we have available. And until the day comes when customized 3D printed helmets are easily accessible for everyone, it's important to be able to set this child up for the rest of their life of having well-fitting helmets, or at least being able to find one.
If you're concerned about your baby's head shape, Shriners wants to help.